It's the last video in hematology, at least for now, because I still have bonus videos, and let's talk about coagulation disorders later. Next Saturday, by the way, we're going to start a new series, which is about fluids and electrolytes, acid-base disturbance. So today, let's talk about ESR, a garbage test. Just get your blood in a test tube and wait for like an hour. The red blood cells are gonna sediment. You get your ruler that you used to use in 5th grade and measure this distance, and boom, boom, you have your ESR. Useless. Words of wisdom. ESR is one of the most worthless tests there is, and yet one of the most commonly ordered. And it means absolutely nothing. I love it. Is this how we're gonna start a video about ESR? Yes, indeed, because it's garbage. Mostly. As you know, your blood is made of plasma and cells. Cells mostly are red blood cells. We're talking millions. That's why the normal hematocrit is 45%. Let's talk about plasma. 55% of blood, water and proteins. Mostly water. By the way, how much water? 5% of your total body weight. So if you're an average adult male and your weight is 60 kilograms times 5% equals 3 liters of plasma. 55%. 45% cells, about 2 liters. That's why your normal blood volume is about 5 liters on average. Water has electrolytes, and proteins are albumin and globulin. Albumin, small but numerous, and it's responsible for the oncotic pressure, because in osmosis we care about the number of particles, not the mass or the size. We care about numbers. Albumin is most numerous. It exerts the most osmosis. Globulin, it's large but less numerous, and we have types of globulin. We have alpha globulin, beta globulin, gamma globulin, which are your immunoglobulins, and the beta globulins are your clotting factors. What happens when you leave blood in a test tube? It sediments. It's called gravity. Okay, this is the oxygenated blood because we get it from the vein, and this tube is called Westerdahl tube. And we add an anticoagulant because what's the use? And when you leave it, it's gonna do it like this. 55% of plasma on the top. It's light, it's watery. Then the red blood cells are gonna sediment. They are heavy, increased density, so they are in the bottom. Between the plasma and the red blood cell is the buffy coat layer, very, very, very thin, and contains white blood cells and platelets. Your red blood cells are in millions. These are thousands. They are teeny, teeny, tiny if compared to the red blood cells. Look at this wonderful definition. Erythrocyte sedimentation rate, the rate at which erythrocytes sediment. Genius. As you know in physics, any rate is change in something over change in time. The denominator has to be time. So we know velocity, change in distance over change in time. ESR, change in distance over change in time. Reported in millimeters per hour. So leave this test tube for 1 hour, and let's say that your normal ESR was 15 millimeters per hour, which means after 1 hour we measured this distance or length and it was 15 millimeters. Today it's performed via automated analyzer. Do you think like the pathologist has time to measure this distance with his ruler? No, he's in his Ferrari. The lab technician is doing all the work. As time passes, sedimentation increases, but ESR stays the same because it's a rate, you idiot. So here is at 0 time. 15 minutes, it's gonna be like this. 30 minutes, it's gonna be like this. 1 hour, it's gonna be like this. ESR stays the same, yes indeed. You want a proof? Okay, let's measure this. So let's say that this distance is 10 millimeters, and in half an hour, which equals 20 over 1, which equals 20. So the ESR is 20 millimeters per hour. After 1 hour, this distance was 20 over 1 hour, so the normal ESR is 20 millimeters per hour. See, it's the same. Sedimentation increases, but ESR stays the same. It's a rate. And here's a quick joke for you. What do they call a test tube that has finished its higher education? Answer, a graduated cylinder. Ha ha ha. Steps of sedimentation. First, rouleau formation. Red blood cells are stacked on top of each other. Then settling, then packing to the bottom of the test tube. It's like the average American adult. First, they live together. Then they settle down and marry. Then, after they become empty nesters, they pack their stuff and move to a smaller house called downsizing. What are the normal ESR values? If you are a man under 50 years old, the normal is 15 or less. If you're a woman less than 50 years old, it's 20 or less. Men more than 50, it's 20 or less. So the ESR increases as you get older, generally speaking. Women over 50, 30 or less. Factors affecting sedimentation. We have pro-sedimentation factors that are increasing the sedimentation and increasing the ESR, or anti-sedimentation factors decreasing sedimentation and decreasing ESR. The pro factors are fibrinogen and immunoglobulins. Basically, they are plasma proteins. Anything that increases rouleau formation, which was the first stage in sedimentation, will raise the ESR. Anti-sedimentation factors such as negative charges on top or on the surface of red blood cells. As you know, opposites attract, similars repel. Physics, baby. So when the red blood cells repel each other, it takes longer for them to sediment to the bottom of the test tube. Your professor might have told you about the negative charges as an anti-sedimentation factor, but why do we have negative charges on the surface of red blood cell? Because the red blood cell is a cell and it has a cell membrane. A cell membrane is a lipid bilayer, which is made of phospholipid and cholesterol. The phospholipid is phosphate and lipid. The phosphate are like this. They have negative charges. Also, the main source of negative charges are the carbohydrates or the glycocalyx of the cell membrane on top of the membrane. That's why the red blood cell membrane is negatively charged. So, as rouleau formation occurs, weight or density increases, so sedimentation is faster, which raises the ESR. Let's talk about IgM, which is the biggest immunoglobulin. It's big and it can overcome the negative charge on the surface of the red blood cell, so red blood cells are gonna sediment faster, leading to increased erythrocyte sedimentation rate. So in cases of cold agglutinin disease, which I've talked about in a previous video, we had IgM. In cold weather, your IgM gets active. Cold agglutinins. Red blood cells stick together, clogging vessels. If it happens in your nose and fingertips, you get Raynaud's phenomenon. This is tissue ischemia. What's the treatment? Warm the patient. When you warm the patient, IgM is not active, so red blood cells are not going to stick together. You're not getting Raynaud's phenomenon. Wonderful. So what are the conditions that increase the ESR and what are the conditions that decrease the ESR? Increase ESR, you have inflammation, infection. Why? Increase fibrinogen and IgG. Same reason. So inflammation includes lupus, rheumatoid arthritis. Infection includes something like TB. How about anemia? Yes, because anemia you have less red blood cells, so you have less negative charges on the surface of the red blood cells. You will have less repulsion force. How about macrocytosis? The cells are larger, they're gonna hug themselves like faster, and they're gonna settle sooner, increasing the ESR. How about multiple myeloma? Yes, because multiple myeloma you have increased rouleau formation because of the paraprotein IgG. Waldenstrom macroglobulinemia because it has the largest immunoglobulin, IgM, that can overcome the negative charges. Pregnancy, why? Because pregnant women have dilutional anemia. Same thing, you have relatively less negative charges, so you have less repulsion forces. These red blood cells are gonna sediment sooner. How about conditions that decrease the ESR? Hyperviscosity syndrome, especially if the hyperviscosity is caused by increased number of red blood cells. More red blood cells, more negative charges, more repulsion force, which lead to them settle slowly. Polycythemia, same reason. You have lots of red blood cells, lots of negative charges. Sickle cells cannot form rouleau. Microcytosis, they are small. It takes a lot of time for them to get close to each other and hug each other and settle. Spherocytosis, again, less rouleau formation. So I've spent the entire video trashing the ESR as a useless test, but there is one instance where ESR is very important. It's going to save the patient's vision or eyesight. It's going to save your day. It's going to save you a lawsuit, and it's going to save you legal fees. So This is called giant cell arthritis. Typically, an old lady comes in complaining of problems with her jaw. Okay, it's very stiff, it hurts like mad, and it's very tender over her temporal area, like temporal bone. When you hear these symptoms, quickly order an ESR. If ESR come back normal, you have ruled out giant cell arthritis. Why? Increased sensitivity of the test. It can rule out, which means increased negative predictive value. When the test is negative, which means that patient strongly does not have the disease. If ESR is very high in case of giant cell arthritis, just with suspicion, go ahead and give steroids fast to save the patient's vision. Okay, in sickle cell disease, if the patient is asymptomatic, ESR is low. Why? There is no Rolo formation. But in painful crises, you have inflammation, so you have lots of fibrinogen and IgG, ESR is going to be high. In sickle cell trait, however, this is a good question, there are no sickle cells. Those ESR should be normal most of the time. ESR and CRP love each other, both elevated in cases of inflammation. ESR starts to rise 24 to 48 hours after the onset of inflammation. Wait, okay? Good things happen to those who wait. ESR elevation is one of the minor criteria for diagnosis of rheumatic fever called the Jones criteria. So in this video, we have talked about physics, physiology, pathology, hematology, immunology, clinical medicine, and epidemiology. A jack of all trades is a master of none. Medicosis has proven this to be wrong. A jack of all trades is a master of some. Maybe medicosis is the exception. Question of the day. Why is ESR normally higher in females? If you understand this video and can answer this question correctly, then I've done my job properly. If you can't answer this question, there is no hope for me or for you. Don't forget to subscribe. You can get all of my notes that I'm drawing in these videos on Patreon. Go to patreon.com/medicosis. You can view, download, and print. Enjoy my videos. Thank you so much. Until next time, be safe, stay happy, and study hard. We're done with hematology. Yay!